Hello everyone, for learning outcome number 3, we're going to be talking specifically about the upper respiratory tract. The nose is going to be the primary passageway for air entering the respiratory system. It can also be called the nasal vestibule, as we see over here. Now the bones, the cartilages, and the sinuses that are associated with the nose were already introduced in Module 5 of A&P 1. Air will normally enter the respiratory system through the paired external nares, which, like I said, are the openings in your nose, and these will open into the nasal cavity. Now we do have a nasal septum that separates the right and left portions of the nasal cavity, and the nasal septum is formed by the fusion of two different bones, which are the vomer and the ethmoid bone. Now the vomer, as we know, is just a small little plate of a bone that forms the bottom portion of the nasal septum, and the ethmoid bone will actually have a bone feature which is called the perpendicular plate, which will form the top portion of the nasal septum. We do have mucus secretions that are going to be produced in the associated paranasal sinuses, which are, like I said earlier, the frontal sinus and the sphenoid sinus. In addition, you will have tears that will be draining from the nasolacrimal duct, which we can see right over here. And this will help keep the surface of the nasal cavity moist and clean. And this tear is actually produced on the opposite side, where we call the nasal gland. So therefore the tear will be able to clean out your eye and moisten your eye, and then it gets drained through the nasal duct and it will fall inside of the nasal cavity. Now inside the nasal cavity we have these three structures that stick out, which are called the superior, the middle, and the inferior nasal conchae. And these bones together, they can also be called the turbinate bones. To pass from the nasal vestibule to the internal nares, which are the opening from the nasal cavity into the pharynx, right over here, which is located in the posterior wall of the nasal cavity, air will tend to flow between these adjacent conchae. As you can notice from this image, these conchae are narrow grooves rather than opening passageways, and the incoming air will then bounce off of these surfaces and churns or mixes around, like, for example, water flowing over rapids. And because of this air turbulence, and this is why these structures can also be called turbinate bones, the small airborne particles, they're likely to come in contact with the mucus that's being secreted by the goblet cells, and that coats the lining of the nasal cavity. In addition to promoting filtration, the turbulence also allows extra time for warming and humidifying of this incoming air. Therefore, we can say that filtration, warming, and humidification of the inhaled air occurs throughout the conducting portions of the respiratory system, but the greatest changes occur within the nasal cavity, and this is because of the presence of these nasal conchae. Now, if you're breathing through the mouth, this will eliminate much of this preliminary filtration, heating, and humidifying of the inspired air. In addition, patients that are breathing on a respiratory or mechanical ventilator, they receive the air that's introduced directly into the trachea. Therefore, as you can imagine, that air must be extremely filtered and humidified to prevent any alveolar damage. Moving on, we're talking about the pharynx. So we can say that the nose, the mouth, and the throat, they will connect to each other by this common passageway or chamber that's called the pharynx. The pharynx is going to be shared by the digestive and respiratory systems. It extends between the internal nares, like I said, and the entrance to the trachea and the esophagus, which is right over here. The curving superior and posterior walls are closely bound to the exoskeleton. As we can see from this image, we can see the cervical vertebrae, but the lateral walls are going to be quite flexible and muscular. The pharynx is going to be divided into three regions, what we call the nasopharynx, the oropharynx, and the laryngopharynx. First, the nasopharynx is the superior portion of the pharynx, and it will connect to the posterior portion of the nasal cavity. So this is why it's called nasopharynx, for the nasal cavity and the pharynx. And it's going to be lined by the typical respiratory epithelium, which is pseudostratified ciliated columnar epithelium. Also, remember we talked about the pharyngeal tonsils when we were talking about the lymphatic system. Well, they're going to be located on the posterior wall of the nasopharynx, as we can see right over here. Next, we have the oropharynx, which, like the name says, oral for oral cavity, and this will extend between the soft palate and the base of the tongue at the level of the hyoid bone. So here is your hyoid bone. This portion right over here is the soft palate, and this is your tongue. And at the boundary between the nasopharynx and the oropharynx, the epithelium will actually change from the pseudostratified ciliated columnar epithelium to a non-keratinized stratified squamous epithelium, which is similar to that of the oral cavity, because in this area is where the respiratory system and the digestive system are sharing the same portion of the pharynx. Now, the posterior margin of the soft palate is what will support this structure that then goes right in the middle of our throat, which is called the uvula. Last, we have what we call the laryngopharynx, which basically will be closer to the larynx, and it's going to be this narrow part, which will include the region of the pharynx lying between the hyoid bone and the entrance to the esophagus, which is going to run posterior to the trachea. The laryngopharynx is going to be the most inferior part of the pharynx, and like the oropharynx, it's going to be lined by non-keratinized stratified squamous epithelium that will be able to resist the mechanical abrasion, the chemical attack, and the pathogenic invasion, as it will also be shared by the digestive system. Now, anterior to the soft palate, we have this bony region, which is called the hard palate, and this is going to be formed by the maxillary and the palatine bones. Therefore, it forms the floor of the nasal cavity, and it will also be important because it will separate the oral cavity from the nasal cavity. Therefore, it prevents food from entering from your oral cavity into your nasal cavity.